Hi, I'm Dr. Colleen Harriger, orthopedic surgeon at Washington Health System Center for Orthopedic Excellence. I'd like to talk to you today about some common summertime injuries. Warm, sunny weather means more time outdoors, enjoying afternoons at the pool, neighborhood bike rides with friends, and summertime sports like baseball and other sporting camps. One thing that can put a halt to all of this summertime fun is an injury. We all want our kids to have the best and safest summer possible, and while making time to get outside in the summer is a must, it's equally important to be mindful of potential risks to help prevent these common injuries. Some of the most typical injuries that we see in the summer are overuse injuries. Summer is a time when kids might be trying new sports or other activities that their body's not used to quite yet. Many kids will sign up for sports camps, which can be a week long of some intense sports training. Some types of activities can result in overuse injuries. These have symptoms like muscle soreness, bursitis, and tendinitis. The most common overuse injuries that we see are around the patient's knee, shoulder, and elbow. Besides overuse injuries, I do see a lot of ankle sprains and fractures, knee ligament injuries, shoulder injuries, and concussions that can result from sporting activities. Some injuries, especially overuse kinds, can be minimized by ensuring a gradual increase in your activity, stretching prior to any activity, proper hydration and nutrition, and proper technique. Trampoline and other playground injuries are also very common. We see an increase in pediatric elbow injuries from falls around the playground, especially the monkey bars, and we can see an increase in concussions, leg and ankle injuries from trampolines. Keeping a watchful eye at the playground and making sure our children are wearing appropriate athletic shoes for activities like climbing, jumping, and running can also help prevent these injuries. Choose a playground that's built over a soft surface. Try to avoid concrete and gravel and instead opt for rubber or wood chips. For younger children, ensure that the equipment is age appropriate. Placing a net made specifically for trampolines around yours at home can help minimize potential for falling off. Many trampoline injuries are also due to a collision between two or more people, so taking turns with only one person jumping at a time can help minimize this risk. The pool is another place that summertime injuries can occur. Kids that are starting to swim may be susceptible to overuse injuries at their shoulders, hips, or knees. There's also a risk of neck or spine injuries from diving into shallow water. The best way to prevent this is to refrain from diving into any body of water if you cannot see the bottom or you do not know the depth. You should also have your kids avoid running near pools or other wet surfaces. And lastly, be sure that there is always a designated adult in charge of supervising children while they're in the water. Injuries from cycling, scooters, and skating are all too common. Under the Pennsylvania state law, children under the age of 12 must wear a helmet while riding a bicycle. It's my personal recommendation that anyone operating a bicycle, scooter, skateboard, or using roller skates should wear a helmet to help prevent serious injury. Knee and elbow pads can also help minimize injuries from any falls. We know you're doing everything that you can to keep your children safe at home, but accidents still do happen. If you're wondering whether your child's injury requires an emergency room visit, or if it can wait to be treated by your family doctor, or even treated at home, here are a few guidelines. You should take your child to the emergency room if you notice any loss of consciousness, see any obvious deformity that could be a sign of a fracture or a dislocation, or if your child cannot stand or walk after the injury. You should also bring them to the emergency room if you have any other concerns. Non-emergency injuries are often treated with rest and decreasing the activity frequency. For example, if a baseball pitcher or softball pitcher is experiencing elbow or shoulder pain, it may be time to reduce the frequency of pitching and try other positions while you rest. Some other treatments that patients can try at home are anti-inflammatory medications as directed by your doctor, ice or heat, elevation of the extremity to decrease swelling, or compression of the affected joint, such as with an ACE wrap or a compression sleeve. Every child deserves a fun and carefree summer. With some preventative planning and paying close attention to any developing pain, you can make sure that your child's break from school is as enjoyable as possible. If you or your child have sustained any orthopedic injuries and would like to make an appointment with me or any of the other orthopedic specialists, just call 724-206-0610.